welcome to another edition of our educative videos. So today we'll be discussing on cervical cancer. Cervical cancer is the cancer that involves the cervix. Cervix is the mouth of the womb, and is that place whereby the midwives and the doctors check how the labor is progressing when they say it is up to 7 cm, 5 cm, thereabout. So when a cancer occurs here, it is said to be a cervical cancer. It is one of the commonest cancers affecting women worldwide, and in fact in developing countries like ours, it is the commonest gynecological cancer. It's the third most common cancer in women, following breast and lung cancer. Now, more than 500,000 cases of cervical cancers are diagnosed annually, and almost 300,000 deaths are usually recorded. And it's not supposed to be like that, because among all cancers, cervical cancer is one that is well known that it could be preventable by the use of available tests, which they are not difficult to come by. So having such high number of diagnoses of cases being diagnosed annually is something that is worrisome. So because of this, we'll be discussing briefly on the various causes of cervical cancer, how we can actually prevent it, and the treatment modalities that are available for it. Now, some of the risk factors for cervical cancer include when there is history of multiple sexual partner. We mean when someone has more than 6 sexual partner in a lifetime, it is said to be a risk factor. Then the use of oral contraceptive, oral pills, family planning pills for a very long time is also known to be a risk factor. Other risk factors include when there is early exposure to intercourse, and this is said to be a risk factor for cervical cancer. Other risk factors include polygamous, and of course it is telling us about the risk of exposure to the primary agent that is responsible for most cases of cervical cancer. Now, human papilloma virus, which is HPV, is a viral infection which is sexually transmitted. Is the major organism that is responsible for most cases of cervical cancer, and it is sexually related. So the more a woman is exposed to different sexual partner, the more she's at risk of acquiring human papilloma virus. And when there is presence of human papilloma virus, although a large percentage of them may get cleared over some time, but for some reasons or in the presence of some other conditions like immunosuppression, like HIV, or women on some immunosuppressive drug, the possibility is very high that she's going to retain most infection of human papilloma virus. So such people will be at risk of having it. Other risk factors include a woman whose husband in the past maybe has died of pineal cancer, or also the presence of other sexually transmitted infection. These are also some of the risk factors for development of acquiring human papilloma virus, and of course subsequently developing into cervical cancer. Now, the prevention, as we have talked about, is about identifying women that may be at risk. In fact, it's so effective that in 10 to 15 years prior to the onset of cervical cancer, the available tests could actually show if a woman would develop cervical cancer. So, and the test is available, which is called Papa-Nicolau smear. Pap smear is a test that is used to retrieve some cells at the level of the cervix in order to be examined cytologically to know if there's abnormal cells that we like, which are usually like pre-malignant. They are precursors for cervical cancer. So, and it is encouraged that every woman or that is sexually active, especially after the age of 25 up to 65, should go for regular pap smear screening. So not being aware of pap smear or not even taking up pap smear regularly is also a well-recognized risk factor for cervical cancer. So because of this, we should all make effort to go for our papanicular smear regularly, and this can be done in most of the hospitals we have around, and of course you can also contact your OB-GYN that would further discuss your schedule with the doctor. So now, what do we do in pap smear? Now, exposure with the use of speculum in order to view the cervix, and subsequently the cells will be taken, preserved, and subsequently taken to the lab for further. The result might come back as normal, which is what is good. Usually, if the result comes back as normal, it is encouraged that every 3 years it should be repeated, and sometimes it could come as infection. With this, antibiotics will be given, and repeat tests may have to be done in the next 6 months. Some other outcomes may also give an idea of if cancer is actually present, but the final diagnosis of cervical cancer would actually be made when histological sample is taken via biopsy, whereby some of the tissue at the level of the cervix will be taken for histological diagnosis, and subsequent management will be done. Now, cervical cancer, the pap smear that we briefly discussed is actually for screening to know people that could actually develop this condition even when the condition is not there. Now, another major way whereby we can even totally prevent the presence of human papilloma virus is vaccination. The vaccination, which is available in some parts of the country, include the cervix, the Gardasil vaccines, and they are known to be against some various forms of human papilloma virus. And by this, it is encouraged that if it is given before the start of sexual exposure, it will go in a long way reducing the incidence and the occurrence of cervical cancer. So for the female children, the male children can also be vaccinated, and from the age of 9 up to the age of 26 are said to be safe to receive the vaccine. And recently it is also said that it could be extended to up to 45 in countries where they have regulation on it. So now, if it is given early, even before the onset of sexual intercourse, it is known to cater for the occurrence of human papilloma virus, which we know that subsequently could result in the cervical cancer that we are actually talking about. Now, what are the symptoms and signs of cervical cancer? Cervical cancer, among all cancers, is one that usually occurs like relatively early in people, maybe in the age range of 40 and above, as against maybe most cancers that we may be talking about more elderly people having it. So because of this, it is very important to start the screening as early as 26 and do it regularly. Now, some of the symptoms a woman can have when there is cervical cancer include vaginal bleeding. It could be following intercourse, which is called postmenopausal bleeding, or any form of intermenstrual bleeding. After menses, there's occurrence of another bleeding without and also the presence of watery vaginal discharge. Usually this watery vaginal discharge could be described as being tinged with blood. Other things include pelvic pain. There could be features of blood loss like anemia, weight loss, weakness, like loss of appetite. All this will be pointing to the fact that could there be cervical cancer when the suspicion will come, and histological sample will be taken for definitive diagnosis. Staging will also be done in order to really classify the patient, and based on this staging, the treatments will be given to the patient. Available options for the treatment include it could be surgical, it could be radiotherapy, it could also be chemotherapy in various combinations. So by and large, with the using pap smear regularly, doing the test regularly could help everyone prevent the occurrence and the incidence of cervical cancer, and also vaccinating our children right from the age of 9, even before the exposure to sexual intercourse. These two are well-known facts that can reduce the incidence of cervical cancer. So by this, we hope that we have gained from this. So we want to encourage you to like, share, and subscribe to our channel in order to give more health information in our subsequent video. Thank you for subscribing.